Hi.
Hi.
Come.
Nice to meet you.
Same here. Short. Come all the way from the car city.
Okay.
Sure. Right. So your vertical height is good. I only have to give you the horizontal projection.
Right.
Yeah. So, do you know what type of improvement you're looking at? You want me to suggest otherwise?
You said what type of improvement? So just like I said, more definition. Like how you say like, is it horizontal? Like
Yeah.
going this way?
Yeah.
I feel like it's like I told you I had braces. Actually, I told the other guy I had braces. And I felt like my jaw was pushed back.
Okay.
Yeah, because they extracted 4 teeth.
And then they took it back in.
Yeah, they took one up here, one down
Okay. With regards to your lower jaw, it's not very defined there.
Right.
So you would want me to define it there as well?
here.
A little bit,
Yeah,
but a lot.
a lot. I would say a lot. I mean,
Okay.
whatever looks the best, but
Yeah. About 4 to 5 millimeters is a lot. It says it's about this much. It's going to come out. And we can get the chin a little bit forwards. Yeah, we could do that. How many days do you have with you?
to stay here.
Or in India?
Whatever we need to do.
Okay, and you can go back to the US, let's say, after 2 weeks?
2 weeks.
The reason why I asked that question is because I'll have to do one osteotomy here, another osteotomy here, and a third osteotomy here. So basically, I'm going to be sectioning your lower jaw into 1, 2, 3 pieces and fixing them individually. Which means you need a good amount of recovery time. We recommend such patients to be with our hospital for about 4 or 5 days and stay nearby in a hotel and then keep coming to us like every other day. And after 10 or 12 days, you should be good to leave. But it'll take a while.
Right.
So that's why I said 2 weeks.
I mean, I could try, but
When do you have your tickets done? You haven't done your tickets yet?
so I booked until like the 23rd.
Of this month?
Yeah.
No.
But I can extend it.
Do you have to?
Yeah. Because I was supposed to be here like 2 days ago.
Yeah, and you did.
Yeah. Because I explained to the receptionist that they messed up my flights here. I guess because of the time difference. So I was actually 2 days late.
Okay. Be 2 days late, that's okay, but I think I would want you to stay for at least 10, 12 days.
I mean, I could do like I could do something like that.
Yeah, because you know what happens if you go to the US and let's say there's a healing issue, there's a small, for example, a trickle of blood coming in, or there's anything very minimal. When you go back to the US, it becomes a big issue.
Right.
They will want you to take a scan, they get you admitted, and then say this and that, and then it becomes a lot of hassle for you.
Okay.
You also land up spending a lot of money.
Right.
Hence, it's better to just hang around here for a few more days.
Yeah.
Once it's totally healed, we give you a green signal. We're like, okay, good, carry on. And also, you're taking a long flight back. And so, with multiple osteotomies, it may not be the best thing to do for you. So, that's why I would recommend you to stay for at least, 12 days you can keep, if not 14.
Okay.
So, let's say we plan your surgery. We can do your surgery either in the evening today or tomorrow morning. Depending on when you're okay. We have time in the evening today, or we have time tomorrow or the day after that. But you need to let us know that to the staff outside, and if possible, you can just shave this part of the hair.
Shave this?
Yeah, or trim it down. I don't. That's going to come in the way for surgery.
Okay.
This is fine if you want to keep your mustache.
Okay.
Do you have any medical issues that I should be aware of? Anytime you've got admitted anywhere, nothing, right? So, genioplasty is a procedure where we do on the chin. It's only to correct the chin. So, I'm going to be bringing this forwards, okay?
Yeah.
But the second procedure that I'm planning is your procedure here.
Okay.
We're going to be bringing this part of the lower jaw outside. Do you want me to show you
Yeah.
another patient what I've done?
Yeah.
You'll be able to appreciate.
Yeah, I was explaining. I don't know if I have that book.
I show you another patient where you can clearly understand what I've done. He had come here with the same similar complaint like yours, and I'll show you what we've done. Explain to you.
Yeah, I know you remember. You probably remember that one, don't you? I really like what you did there on that.
Oops.
That was the
This is the thumbnail. Okay, so how do I go back? Yeah. Yeah, we've done both for him.
yeah.
I'll show you on the scan how that will look. Yeah, this is similar.
Yeah, I saw that one. That was in the book too.
But you'll understand more clearly when I show you the scans, more than this.
Okay.
But a similar thing, yeah. And the title also I remember because I've said for boys, because it doesn't work very well for women. So you can see now what has happened. You can understand yourself. So just see like this, the cut has been made like that under your nerve,
Right.
and this has been brought outside. That's 5 mm.
Okay.
And then you can see the chin was long, has been brought outside. And similarly on this side, we've brought it outside.
Right. Okay.
So that's exactly what you need. Similar to this, absolutely similar. The thing is though, because we're moving everywhere, so you cannot sleep on the sides for a month or two. You have to be very careful. There should be no, because I'm just using 2 screws. It's not a lot of hardware, so it's not like rock solid. You go bump yourself a little bit, it can move a little bit. So you have to be very, very careful for 4 weeks.
Okay.
After 4 weeks, this bone that you see here inside all gets fused. The outside just stays and you get a nice line.
Right.
And then if you want even more exaggeration, let's say 5 years, 10 years, 20 years down the line, you can go for fillers around this line,
Okay.
which will then really give you, that's when you age. I mean, now you'll not need anything, just saying. And then you don't have to take these plates and screws out as well. All these gaps would heal.
Okay.
So when we say genioplasty, we're talking about this procedure. And I refer to these as angle osteoplasty because we're doing work on the angle.
Yeah.
Angle osteoplasty can be done in many different ways depending on what the patient needs to be done. For some, we remove some bone. For some, we osteotomize. For some, we shave a bone. For some, we remove the masseter muscle. Depending on what needs to be done. In your case, this is exactly what needs to be done.
Okay.
So I'm just going to make a note of that because it will affect in your recovery as well as costing.
So I just have a quick question.
Sure.
So will any of that change? Because I feel like in this area, I feel like it's kind of flat.
It is a little bit flat,
Yeah.
but it's all right for a guy to be flat there.
Okay.
Once you get it strong here and nice, I think it's fine. Because you don't have, you probably have mixed ancestry, but you don't have very strong African features apart from your hair.
Okay.
The way you look, no, because otherwise you would have a strong malar bone. So I don't want to create that now.
Right. Yeah.
We just make you look more masculine, and that's it.
Yeah.
That should be enough.
Okay.
And if you want, you can always do those procedures later on. Cheek augmentation can be done with just artificial material, and they're very good in the US. They put silicone and put a screw here.
Oh, okay.
That's fine. That's temporary if you want. These are all lifelong things.
I mean, it's really
this is
not
gonna
even
look
a big
good.
issue. The only
Yeah.
thing I feel like is when it's flat here, it kind of makes my
Yeah.
eyes look like I got
Yeah.
bags.
If you project this, and then that's not gonna look. That's true. All right. Do you have any more questions for me?
No, sir. I mean,
This is okay.
yeah.
When did you have your food last to eat or drink?
Like 7 this morning. I had breakfast.
Did you have a heavy breakfast?
No, I didn't have a heavy breakfast. No.
So anyways, while we work your case and get the bloods and everything else done, don't have anything to eat or drink.
Okay.
Because if you do, then can't do it today then.
Okay.
All right?
Okay.
I'll see you again in a while. With pleasure. Take care.